Okay, guys, here we are again. Chapter 4 is where we're at, lesson number 2. We again have 4 objectives for the day. Today's are to identify legal violations related to healthcare. Number 2 is to define abuse and name signs that someone may be being abused. Number 3 is to identify the responsibility of healthcare workers in reporting abuse. And number 4 is to discuss some ethical principles. So with that, a lot of these things, it seems like it should be common sense, but unfortunately, we really have to follow some laws in order to protect ourselves in the healthcare field. So you need to be familiar with some of these things that can happen or some of the violations that can occur so that we don't do those kinds of things. All right, so first of all, let's talk a little bit about laws. There's basically 2 different types of law. There's civil law, which are between 2 different individuals. And then criminal law is an individual in the governing body or the society. So civil laws would be like, you did something to me and I don't like it kind of thing, versus criminal law. Those would be things like murder and abuse and things like that. Abuse is the only criminal law that we're going to be talking about. The other ones that we're going to be talking about are civil laws. So make sure you know the difference between civil and criminal law. Another key term you should be familiar with is litigation. This is the legal action that's been taken against a person who's been broken the law. So in other words, you're suing somebody, that kind of thing. And last but not least, another key term is liability. That is your responsibility to act within the law. So as healthcare workers, we have a very defined responsibility, and you can't step out of that. You're responsible for those who are in your care, that kind of thing. So now we're going to start talking about torts. Now, a tort is a wrong that has been committed, and there's 2 kinds. There's unintentional and then there's intentional. So unintentional tort, an example of that would be negligence, and that is failing to do what a normal and reasonable person with the same education and training would have done in the same situation. So for instance, if I'm a nurse aide and I am taking care of a patient and I didn't put the bed rail down and the person rolled out of bed and broke their hip, I would then be negligent for that act because other nurse aides with the same education and the same training in the same situation would have put the bed rail up. Now, another unintentional tort is malpractice. The difference between negligence and malpractice is that with malpractice, the person has a license. So I, as a registered nurse in the state of Pennsylvania, have a license. So if I had done the same thing, because I had the same education and training as other RNs, and the person rolled out and broke their hip, I could be sued for malpractice. So the difference basically of that is whether or not you have a license. So a lot of healthcare professions do have license. Nurses, physical therapists, things like that. So failing to do what a person with the same education and training would have done in the same situation. As far as intentional torts, we're going to talk about a few. The first one is defamation, and there's 2 kinds of defamation. Defamation is making untrue statements about someone's character. And so if you write it, it is called libel. And if you say it, it is called slander. And I'm sure you've heard of those terms before. The next intentional tort is assault. And the one after that's battery. A lot of times people confuse assault and battery because it seems kind of backwards what you're going to think. So assault is threatening or attempting to touch somebody without their consent, and it makes that person fear bodily harm. So something that a healthcare worker could say that might get them charged with assault is something like, if you try to get out of that chair, I'll tie you down. That would be assault because you've threatened. All right. Now, what you probably thought was assault is actually battery. And battery is when you touch somebody without their consent, or you restrain them and you keep them from leaving their room. So, for instance, if we do surgery without somebody's permission, that could be battery. If we touch somebody, if we hit somebody, all of those things are battery. We're going to be talking about tomorrow what an informed consent is. And basically, before anyone has surgery, we have to get what's called an informed consent, which basically means that the person has to sign that they do want that surgery so that we don't get charged with battery. Fraud is another intentional tort, and that is a deception that could cause harm by misrepresenting yourself. So this would be a nurse aide that represents himself as a nurse, or a nurse who represents himself as a doctor, that kind of thing. That is considered to be fraud. False imprisonment is confining somebody against their will or using restraints inappropriately. So we have these chairs in healthcare called Jerry chairs, and like you sit them in a chair and you put the little tray over them, and then they can't get out and they're stuck there. You could get charged with false imprisonment for that, or confining somebody to their room and not letting them come out. Those kinds of things would be false imprisonment. Invasion of privacy is another intentional tort. That is when you violate their right. Remember those patients' rights that we just talked about yesterday? When you violate their right to keep information about them from others. So not maintaining privacy, not maintaining a curtain closing where you're giving them a bath or a shower, or shutting the door when you do those types of things. That would be an invasion of privacy, as well as leaving a chart out, talking about a patient in front of other people, revealing private information about somebody. As I gave the example yesterday, if you see somebody in the grocery store, you can't just share information, and that can be very hard and very difficult, especially in a small place like Fulton County where everybody knows everybody. And if they know that you work in the healthcare field, or they know that you're taking care of somebody, they're going to want you to give them information, but you can't do that. This includes information over the phone. I can't just call in and get information from somebody. I can't, because it could be that I'm pretending to be someone that I'm not. So we cannot give information over the phone. And this law was really protected by that HIPAA law that we talked about before, which stands for Health Insurance Portability and Accountability Act, or HIPAA. So the three things that HIPAA regulates, and this is really important and you really need to know, is this law regulates who can look at your information, how it sets standards for how information is stored, and it requires facilities to even set rules about how employees can access their own medical records. So basically what that means is who looks at your information. Only the people taking care of you are allowed to see your information. If I'm taking care of you, I'm allowed to look. But if I'm not taking care of you, I do not have any reason to be in your chart. How information is stored, especially in this digital age, we have to protect it. We have to keep it from hackers, if you will, that kind of thing. So we have laws and things set for how it should be stored, where it should be backed up, how it should be backed up, off-site, that kind of thing, so that that information can get to people who it does not belong to. And employees, even though you work there, are not allowed just to randomly access your own medical records. Are you allowed to see them? Yes. But you have to go through the same channels as everyone else. If I want to see my medical records, I need to go to that department in the hospital and sign a paper that I want to see them. Just because I work at a facility doesn't mean that I can just help myself to the computer and look them up. You have to follow the same rules as everybody else. The last intentional tort that we're going to talk about is larceny, and that is just easily put stealing, which is another word for stealing. You can't take things that don't belong to you. You can't take things that belong to a patient. Common sense, right? All right. Now, as I said, there's a difference between civil law and criminal law. The ones that we just talked about were civil law violations. The criminal law violation that we're going to talk about is abuse. And abuse, your book defines it as a repetitive and deliberate infliction of injury on someone else. And there are different types of abuse. And you guys probably have heard these, if not all of them, some of them before. Physical abuse, psychological abuse, including involuntary seclusion, sexual abuse, and elder abuse. So physical abuse would be things like hitting somebody, biting someone, slapping, shaking, or it could also include just failing to provide that person's basic needs, failing to provide them with food and water and shelter, those kinds of things. Psychological abuse is threatening harm, teasing somebody in a cruel way, isolating the person, making sure that they don't have contact with other people. And then sexual abuse is inappropriately touching somebody or even making sexually aggressive comments can be considered sexual abuse. The elder abuse you may or may not have heard of before, but it's taking advantage of an elderly person by not caring for them, physically abusing them, withholding their money. Unfortunately, that may even be done by the person's own family. So those are the kinds of things that we have to look for when we're caring for people. Now, as healthcare workers, we have a very important responsibility. You are required by law to report any suspected abuse. Now, I didn't say that you had to prove it, and there's a reason. If you suspect it, you have to report it. There's no ifs, ands, or buts. You can't wait till it's verified. If you have any suspicion that someone's being abused, you have to report it. Just like I, as a teacher, we're called mandated reporters. As a nurse, I'm required. As a teacher, I'm required. So if you are ever put in that situation, you do need to know that you're required by law, and failing to do so could put you at risk for your job and keeping your license. So, you may be put in a situation where sometimes maybe a woman says, hey, can I tell you something? Can you just promise that you'll never tell anybody? All right, you can't necessarily do that, because if she tells you her husband's abusing her, you're required by law to report that. Now, I said if you have signs, you have to report it. So let's talk about what some signs could be. It could include poor personal hygiene. It could mean that the person's not clean, their clothes are dirty, their hair's not combed. It could mean, especially with little kids, maybe their skin is irritated from urine soaked underwear because they haven't been allowed to change, or they haven't been allowed to go to the bathroom and they have to go in their own underwear kind of thing. It could be dried stool on their buttocks. It could be the fact that they haven't brushed their teeth in a long time. Loss of weight, dehydration, unexplained bruises, or maybe the person has a lot of bruises and they're all in different stages of healing. And you've seen, you know the different stages of healing. Sometimes they're purple, and as they get better, they turn a little green. Well, if someone comes in and they have purple bruises and green bruises and yellow bruises, and they're all over, that's a pretty significant sign that someone's being abused. Maybe their explanation of how they got hurt doesn't line up with what they say happened, or how their injury occurred. So they say they fell backwards, but looking at the x-ray, you know that couldn't have happened. Patches of missing hair, cigarette burns, rope burns, unclean living conditions with rotting food around, unchanged sheets, lack of heat, lack of water. Those are all signs of physical abuse. Somebody who's being psychologically abused may have different symptoms. Maybe it's that they appear anxious or fearful, especially when the abuser's in the room. Maybe they don't make eye contact, or when the abuser walks in, their eyes go down and then they make no eye contact, or all of a sudden become very, very quiet. Abuse could even be considered if they have a medical condition and it's not being cared for. So for instance, diabetes, but they aren't providing the care that they need. They aren't controlling their blood sugar, things like that. So if you see signs like that, you're required by law to report it, whether you know abuse is happening or not. It's not your job to determine whether it is or isn't happening. It's your job to report that it may be happening. Last but not least, we're going to talk about some ethics and some ethical terms. Ethics are our moral kind of rules for ourselves that we use to conduct our own behavior. Professionally, you as a healthcare worker are bound by a certain code of ethics is what it's called. And you're required to maintain them. So the first one is beneficence. It's a big word. Basically, that means doing good for those that you're taking care of and preventing harm from coming to them, that kind of thing. Non-maleficence is avoiding harming people that you're caring for. You need to be gentle and kind with the people that you're taking care of. Justice is treating people all equally and all fairly, no matter what their race, no matter what their religion, their culture, how they may or may not be disabled, how they may be able or not be able to pay. Fidelity is acting with integrity to earn someone's trust. Autonomy is respecting a person's right to make their own choices and have their own preferences. And last but not least is confidentiality. And we've talked about that quite a few times already in this chapter. But basically, it's maintaining that privacy and respecting and keeping their information to yourself. So those are all professional ethics. Personally, your ethics may come from values or cherished beliefs that you may have from your culture, from your religion, from your life experiences, or those kinds of things. So believe it or not, that concludes chapter 4. Now tomorrow we will have an additional lesson on chapter 4 about some more information that you need to know regarding laws and ethics that you have to learn. But as far as the chapter itself goes, we are done. If you have any questions about any of these terms, these legal terms that we talked about, the legal violations, or the ethical terms, please shoot me an email, and I will see you guys the next time.